I'm Dr. Mattox with Innova. Let's talk a bit about your anesthesia options. So, I want to talk about a common misconception about anesthesia or sedation. People think of it like it's an on and off switch, when in fact, it's like a spectrum from being wide awake to being relaxed, to being deeply relaxed, to being really all the way asleep. And I want to break down each option so you understand each a little bit better. So we always start with the foundation of using local anesthesia. Think of this as like the numbing shot you get at the dentist that you're probably used to. We pretty much use this for every procedure just to numb the area of the surgical site. Our next option is laughing gas, also called nitrous oxide. So a lot of our procedures require a lot of injections, multiple of the numbing shots. And then during the procedure, it's common where you'll kind of feel us working. You'll feel a little bit of pressure. Most patients are comfortable, but the bottom line is the nitrous can kind of take the edge off of this process. It just smooths it out a little bit and just makes that whole experience a whole lot easier. With nitrous, you actually can drag yourself to and from the appointment. You can eat normally. Keep in mind you're wide awake during the procedure. It just kind of makes you just a little bit more calm for that procedure under local anesthesia. Our next option, which is probably our most popular, is IV sedation. So with IV sedation, you're deeply relaxed. You won't remember anything for the procedure, but the benefits, you're able to breathe on your own, and we maintain some ability to communicate during the procedure. Bottom line is you're super calm, comfortable, relaxed for the procedure, and just makes it really easy. This is a great option for really most of our procedures and most patients that have moderate anxiety. Look, I get it. Most people are not excited to come to the oral surgeon, so it just makes that process a lot easier. Keep in mind with this, you cannot have anything to eat or drink starting 8 hours before the procedure. The one catch with that is you can do water up to 2 hours before the procedure. Now, the other thing to keep in mind is you do need a ride. You need somebody to take you to that appointment. You need somebody that's going to stay with you that entire duration of the appointment. And you need somebody that's going to take you home afterwards because you cannot drive. Our next step is general anesthesia. So general anesthesia is where you're completely asleep. And in this scenario, we would need a breathing tube for your safety, as well as to bring in another anesthesia provider like a CRNA. Now, this is a good option for complex procedures, as well as patients with really extreme levels of anxiety. The same guidelines apply in terms of not being able to eat before the procedure, as well as having a ride after the procedure. The bottom line is safety is our top priority at Nova. We use state-of-the-art equipment and an experienced anesthesia team to make sure you're comfortable during your procedure. Now, keep in mind, not everyone is a candidate to be put to sleep in our clinic, so we take a careful health history to make sure. I look forward to discussing any questions you might have, and thank you for choosing Innova.